Tell us your name and spell it for us, and tell us where you received your training, what you trained in.
Okay, my name is Steven Youngblood. That's STEVENYOUNGBLOOD, and I graduated University of Florida in a degree in physical therapy.
And how long have you been at Lakeland?
I've been here 18 years now this year, so really enjoy working here. I love the diversity in patients. I love the challenges that it presents. I love patient care, and in my role, also team leader as well as a clinician working with patients. So I like the hybrid of both. So I still keep my hands in with patients and patient care, as well as the role of management comes along.
So in your role as a manager, describe some of the highlights of that particular role, the sorts of people you supervise, some of the good things about that.
Okay, well, I think we've assembled a very good team of therapists here. We have a lot of longevity on our staff here. We have some 18 years. I mean, a lot of people think, wow, that's a long time to be at a certain job, but I'm not setting the record on some of our people on our team. We have some people that have been here very well experienced. We try to hire the best and the brightest that have a passion for physical therapy, occupational therapy, or speech, because we all three of them are under our rehab title. At the current status right now, we're in this hospital is acute care physical therapy, so we're seeing people, and an average length of stay is around four days or so. It's a lot of, you're seeing people, moving them to the next level of care, recommendations, making sure they're safe for discharge, making sure that families are educated, nurses are educated. There's a big education, a big communication piece when you're seeing patients for a relatively short period of time. When you're here, that you want to cover this information, make sure they understand it, make sure they can, understand it so that they can have good quality outcomes.
If Lakeland were to build a rehab hospital, how would that change the sorts of services that you offer?
Oh, it'd be incredible. The first thing is, we're a very large hospital.
Once you have them
Yeah, let's
included.
ask
Yeah,
what's
do the-
incredible.
Yeah, you've got to sort of
If we were to
restate
get
what
a
I said.
rehab hospital here, it'd be incredible, and they go into.
Oh, okay. Okay.
Okay, hold on a second, we're gonna
Okay.
just
Back it up then.
adjust the mic a little bit.
I did this a couple years ago in Jamaica, and I kept
Okay.
forgetting to kind of rephrase the question.
Because it's so
Gotcha.
different from what you
It's
taught.
what
You
you're
speak
using.
your-
Oh, yeah, sure,
Just
yeah.
sort of ready to
Sure,
jump in and
sure,
answer it,
sure.
but, yeah. I must say, I like looking at this side better than that side.
Yeah.
You're doing it.
Okay.
I actually didn't even realize you had rehab patients until recently. so.
Okay.
Okay, so what, are you getting a pretty good level on?
Well, it was up to 100, and I could start to hear the ambient noise when people came by, and he wasn't pegging them. So
Okay.
I think having it a little closer, I think it should be better.
Talk a little bit for me, please, so I can just hear our level here.
Testing, 1, 2, 3, testing.
Yeah, it's better.
Okay.
That's better. I'm still rolling.
Okay.
Okay, why don't you,
Rolling.
okay.
Okay. It would be incredible to have a rehab center here at Lakeland Regional. It's a very large hospital, a large regional hospital. We serve a very large area of patients. There are a lot of patients that are in need of inpatient rehab services. And people ask, what's the difference in inpatient rehab? The difference in inpatient rehab is it's very intense. These are for your patients that someone who's maybe suffered a traumatic brain injury, a complicated stroke, maybe a spinal cord injury, multiple traumas, complex orthopedic conditions, all those type of injuries and impairments. And in an inpatient rehab, they'd be able to work on them for a much longer period of time, 3 hours a day, skilled disciplines between PTOT and speech, and it would be very targeted on rehab. Currently, we do acute care physical therapy. We work with them, but in the acute care phase of the hospitalization, physical therapy, occupational and speech is very acute. You're working on stabilizing the patient, make sure they're safe, and then moving to the next level. The rehab hospital would complete that transition, so a person would go from being stabilized medically and then moving into the rehab where they can really focus on their rehab and their recovery from a physical, occupational, and speech language pathology standpoint.
Can you tell us about a patient that just really surprised you because of either their motivation or whatever, what that was like for you?
Oh, that's great. We've got some great stories of that. We recently had a patient who was in a bad car accident, had a spinal cord injury, and he was with us for a short period of time. He's in an intensive care unit, and it's one of those things you just pray and you hope he's going to work really hard and make the gains. And he worked very hard with our therapist here, Then he, because we didn't have a rehab center, he ended up transferring to another rehab center, but that rehab center was almost 300 miles away. And so his family had to relocate and everything. So of course that was challenging, but he did make some great gains, and we actually had a chance to see him come back. He came to one of our staff meetings and he said, "I want to show you something." And he got from the wheelchair and he pushed up, and I mean, half the staff started crying. I mean, he actually took some steps. And this was someone who, when we first saw him after the spinal cord injury, we just didn't know, because it was a high injury. It was complicated, and you just pray and hope that your interventions are going to help with him. And he put he put all of his effort into his rehab. He went all out, worked with them. If they told him to do 10, he did 20. I mean, he was one of these type of people that really worked very hard, and it's very encouraging to see that. It really kind of keeps you going when you see patients have that kind of return. It really lets you know, wow, I'm really glad I got into this profession.
As you continue to think about him and he's back in the community,
Mm-hmm.
how do you think Lakeland can help him getting his sort of new life back into the community?
Well, for one, a rehab center is an integral part of the the town here, Lakeland. I mean, I would love to see where we have a rehab center here, and it's like, oh, I'm coming to Lakeland to go to the rehab center because it's really, really good, and this is where we want to be. We have a lot of populations that develop a trauma. They get in a car accident. It's unplanned. It's very difficult to have that resource there, that your families and loved ones don't have to relocate and have to go way out of state to try and find a rehab, that they can be right here, that the doctors and nurses, all the care can be so well integrated in one site would be amazing.
Talk about some of the frustrations that you have seen in family members, the larger family unit related to a person with a disability. What are the big stressors that have come up?
Probably the big stressors that you see a lot of times with families are they'll have a patient who's had an injury. That would be someone who would go to a rehab center, let's say. Let's say they had a spinal cord injury, and they're in a hospital, and you have nurses, you have therapists, you have aides, you have everybody that are helping them out. And then it gets to the point of it's time for discharge, and now you have to learn it, and it kind of hits home, wow, I have to take care of this, and this isn't like 1 week, this is the rest of his life, or her life, that they have to work, and they really have to make a change in their life, and have to really kind of prioritize things and figure out how to get the right equipment. And that's where us as therapists on the inpatient and the acute care level, we will put recommendations of what kind of equipment you need, what kind of services. And it's always been frustrating not having a rehab center where you'd love to have this place where they'd be able to continue their therapy, and a lot of times they have to go somewhere else. It's several counties away, a state or two away, and it can be very difficult with that. Family actually has to pick up and get an apartment in another county or something like that just to be there.
You've been at Lakeland Medical Center a long time. What makes you think this hospital is well positioned to embark on a rehab center?
I think the hospital is well positioned to embark on a rehab center. For one, to me, it's been a long time coming. When I first started here at Lakeland Regional, I was like, wow, this would be great if they had a rehab center. And we've always kind of hoped that they would come across and get a rehab center. I think it's well positioned because it serves a very large area. We have a large population of people in need with this. We also have a high indigent population. That sometimes even resources to go anywhere can be difficult and a struggle for them. I just think it's just part of the delivery of quality care. It kind of goes along with our caring principles of caring for people. It just is. It's time for it.
For those that aren't too familiar with the rehab world, describe briefly the rehab professionals that are integral in care.
Okay, the rehab centers professionals exist of there's always some type of director of services, but you're talking about physical therapists, occupational therapists, speech and language pathologists. You sometimes have other rehab professionals. Certain activities directors. You have rehab counselors. There's a lot of other different layers with that. And of course, the rehab nurse. All these things, even at the nursing care level, it's different because the focus is so much on function and recovery versus in like say an ICU, which is stabilizing a patient, getting them safe that way. So it's there's a big big interdisciplinary team, and probably the biggest thing, and also physiatrists, many times physiatrists or medical physicians, but there's a lot of teamwork. They'll have a conference, they'll meet on a patient, they'll talk about how their plan of care is, and make sure things are integrated so that they're looking at their ultimate discharge home. How well is the family prepared? How is the patient responding with therapy? Do we need to increase this? Do we need to cut back on this? It's all that interdisciplinary communication that you have in a rehab center that you sometimes don't have if you didn't have that.
If you could put together your ideal rehab team, maybe it's people you work with already,
Mhm.
maybe what characteristics are you looking for?
Okay. Gotta have passion. I mean, you gotta be passionate about what you do. Someone who really wants to be there with that patient, have to be that patient advocate. Don't get me wrong, it's hard work. Being a physical therapist, I mean, sometimes it can be physically, emotionally, and mentally draining because you're seeing these patients, and some of these injuries are very, very complex. But it's someone who's very motivated with the patient, someone who has a good understanding about what's available for that patient, someone who's had some background with dealing with these type of patients that have either had previous experiences or they've had continuing education classes on top of their original schooling directed towards the care. We want to see people that are using evidence-based practice on what they're doing. All that stuff is very important, to get the best clinical outcomes of your patients.
And likewise, what are the most important characteristics of patients for a successful rehab outcome?
Okay, well, motivation is a big plus. One of my things that I find out, me personally, I feel I'm pretty good with motivating the unmotivated sometimes, because most of our patients, they don't choose to have something like this happen to them. It's a surprise. Sometimes they can be very angry and upset. As a rehab professional, you have to be able to work with that patient, have that patience, but at the same time be able to push and motivate that person and be able to get them to do stuff that sometimes they don't even think they can do. So that's important that you have the rehab professional that can do that. But for the patient, having a motivated patient, have a patient with strong family ties, it's always a very good plus, because you have that integration for when they do leave the rehab center, that there's going to be carry through with the plan of care, the exercises, or whatever's been recommended for the person.
A lot of times patients that have a significant disability functionally have lost hope.
Mm-hmm.
How do you go about helping instill hope in someone that is presently hopeless?
That's a good question. Instilling hope in a patient that sometimes feels hopeless, sometimes you have to look at things as baby steps. Many times a patient, let's say they had a spinal cord injury, and they were a professional baseball player, and they got in a car wreck, and now they have this. They're thinking, how am I going to be able to pitch in the major leagues? How can I pitch in the major leagues? And you have to slow them down and say, look, we need to work on our transfers. We need to work on taking steps. You have to take little baby steps. So sometimes you have to set your goals and your milestones as small, incremental, so that they don't just get lost trying to see the big picture and never progress. So it's important that you look at it that way and try to motivate them. One nice thing in a rehab center too is there's generally like a general area where they eat together, or there's other people going through the same thing. So there's a sense of camaraderie amongst a lot of the patients. And sometimes they can say, wow, that guy wasn't doing too good, and he's been here 2 weeks. Look how good he's doing. Well, I can do the same thing. So there's a lot of buy-in that way, and that helps. That helps them to see that it's kind of coaching one another, and that kind of helps with some of those patients that may feel hopeless initially when they first have something like this happen.
In terms of helping foster wellness and fitness and exercise and those sorts of things after discharge?
Okay. After discharge, when a person would leave a rehab center, it's important that there is that follow-up either for outpatient services, home health services, to kind of integrate the person back in the community. And there's community resources, and that's one of those things that would like to see, that collaboration with some of the community resources for a lot of these patients too. And that's why it's also very important that when you are working with this person, you are involving that education on what's available out there early, so they don't just get hit with all that information at the end. So they've been able to have a chance to integrate all that. And you can do that in a rehab center because you're constantly communicating with other people on your team, and you're dealing with multiple disciplines. So what I might not think of as a physical therapist, the speech and language pathologist would bring up, oh, by the way, we have this thing for our patients. And like vice versa. Maybe the physician would bring this up and, oh, I didn't realize that was available. So you have a lot of heads putting ideas together to help with that. But yes, they definitely want to have that follow-up when they leave the community so that they stay healthy, so that they reintegrate back into the community and be, as functional as possible.
You could take a step back.
Okay, Cameron ruling.
So as you look at, to take a step back and look at the big scape, healthcare perspective
Mhm.
from, at this point, what are the big opportunities that we have? What are the obstacles that we face relative to rehab?
Okay. Well, one of the big, I'll just talk first about some of the opportunities for rehab. As we all know, healthcare costs are going up and it's very expensive nowadays. But one thing I like is rehab is many times focused on the prevention and preventative care. And when we're looking at patients that are undergoing a rehab in a rehab center, you're looking at trying to get them as functional as possible. I mean, to get those patients back to doing what they're going to be able to do. So in return, it helps both the patient and back to society if a person can come back to work. Some of the big obstacles we face are, with ever since the recession in '08, people have had to sometimes take choices. Do I get health insurance or do I, keep the lights on? Usually keeping the lights on wins out. So it can be hard for people to get insurance, and and healthcare can be very expensive. So sometimes that can be a real challenge. Having a rehab center here at the hospital is a benefit because we'd be able to have some of those patients that may have an easier time being right here on this campus here versus having to travel somewhere else. They'd be able to have their therapy right here, not have to relocate to another area, and be able to deliver care in a central place.
Maybe you could jump in. Maybe you could describe what it looks like when someone is cared for in a distant place. Like maybe give an example of a patient you had that had to travel and what that was like.
Okay.
Maybe a little insight.
Secondary infections, is it,
Okay.
are they more susceptible? Is their immune system down so they are able to get more infections? And the caregiver, I mean, talk about the health of the caregiver when they have to travel and
Yes, yeah.
just getting reintroduced to a new environment. I mean, it's scary enough coming into one place, you get stable, and then all of a sudden, as soon as you feel comfortable
Sure.
with your care and feel okay, you're transported and have to get used to a whole other set of people again.
Mm-hmm. Sure, I could. One of the challenges for patients is if they are not having a rehab in one area, they have to transfer to another state or another county. It's a lot of stress on the family.
But make sure you're talking to Karen again.
Oh,
Since
okay.
You're kind of cheating.
Okay.
Which is
Okay.
natural. That happens.
Okay.
That's totally
All right.
natural. Because that was such a great answer.
Okay. All right.
I didn't hear it the first time, so you tried again.
Okay. All right.
She was sleeping.
One of the are you ready?
Yeah.
All right. One of the challenges if you have a patient and like we were saying before, if you don't have a rehab center and they have to travel out of state or out of the county to another area, it's very traumatic to the family. They have to get up from where they're at. They have to relocate. It's a lot of stress on the family, and many of the family members will spend a tremendous amount of time, as they should, with their family members. But sometimes, being in the hospital and then they have to handle them at home, they can get very, for lack of a better term, very burned out. It's very difficult for them. So having a rehab center here on site allows them to not have to worry about the transition so much because it's all in one area. They're in the intensive care unit, they're on a step-down floor, or they move right to the rehab. It's right here at Lakeland Regional. You also have to think about infection and delays. When you have someone who has to travel, let's say I'm just going back to a spinal cord injured patient. If you have someone who's an involved spinal cord injured patient and they're here at Lakeland and they would have to travel to, Pensacola or something like that, that's a long way to go in either an air ambulance or a transport. There's always risk of problems that way. Plus, it's a foreign area, and the communication is almost always going to be better if you have people on site because they're working in the same network, the same system, the same computer system. Everything is right there. The continuity of care is a lot better for those patients when everything can be delivered in one central area.
Excellent.
Some of the evidence in physical therapy these days is suggesting that intensity really bumps up people to the next level of ability,
Mhm.
especially stroke, that sort of
Mhm.
thing. Insurance will pay for a certain number of hours a day. What if they'll pay for 3 and the patient needs 5 or 6 or 8? What would you say to prospective donors that their money would do?
Okay. With some of the challenges of, can you time that one out?
Sure. Yes, go ahead.
Okay. I just wanted to. I'm trying to rephrase the entire question.
I could try saying it again, would that help?
Okay. Yeah. Can you re-say it again?
Current evidence in physical therapy suggests that intensive therapy is very effective. If insurance is only going to pay for a portion, someone's got to pay for the rest. What
Mhm.
would you say to prospective donors that would suggest they're going to get their money's worth out of what they're doing?
Okay. Intensive therapy has been shown to a great impact in our patients that are going through a rehab center. Unfortunately, sometimes payers are only going to pay for a small amount, and many times you have a patient that needs more than that. You have to realize that with certain diagnoses, the earlier intervention is going to be the best intervention, particularly people with strokes. Early intervention, study after study has shown that the earlier they get these people using their limbs and teaching them these strategies, the better the outcomes will be. It doesn't do much good to try and put the money after the fact, after they've had a stroke for 10 years, and now we say, oh, I think we need to do some more therapy at this point. They need to do that in the beginning. So that's where people can see the most return because you have that intensity early, and it translates to better outcomes, reintegration back into the community, just patient satisfaction, family satisfaction, and the other thing too is we have a lot more people getting strokes at a younger age nowadays. The obesity epidemic, going back to healthcare costs. Some people decide, well, maybe I don't need to buy my blood pressure medicines because I need to keep the lights on. Well, then they have a stroke and then they have a problem. So it's a lot of challenges facing people nowadays, and the rehab aspect of getting people back on their feet, getting them back and functional, being able to do what they can do so they can participate in society, they can be families, husbands, wives, take care of their kids is very, very important.
If you had to, someone stops you in Publix and says, give me one sentence, tell me in one sentence why you think you need a rehab center at Lakeland, what would you say?
If I had to say one sentence of why you need a rehab center in Lakeland, it's because it's what's best for the patients. Right now, it is it's the elephant in the room that needs to be here. It's been a long time coming. It's the type of thing when you have a building of this size with this many patients, this big of a community, with as much trauma as we do, with as much patients having strokes and complicated fractures and all that this is that one missing piece that we need to have to get the best outcomes for our patients, and to it's just the right thing for patients.
Good.
Nice, thank
Good.
you.
You got other things, folks?
I don't know.
No, I think he covered.
Okay.
You did well.
That was great.
All right.
Before you go, and I have no
Yeah.
idea how you would even answer this, maybe you come up with this brilliant answer, but.
Okay.
Oh, I do have one too.
Oh, so do I.
Okay.
I have one more too, okay.
I got 5 more.
Okay.
Since you're all put together
Okay.
so well, we're
All
going to
right.
take advantage of it.
One of the pieces that we'll probably do is a community awareness piece.
Mm-hmm.
So, because obviously the community as a whole doesn't know at this stage of the game that this is coming. So, from a community awareness standpoint, what would you say if you knew that your little piece of this video was or your little piece of this puzzle here was gonna be in the video that would help people in the community to understand why this is important?
Well, I'm healthy, I don't really.
Yeah.
Why would I give my money for this? I'm healthy. I
Yeah.
don't have high blood pressure, I'm not gonna have a stroke,
Mhm.
I'm not gonna have, why? But you employ these folks,
Mhm.
these people are part of our community,
Yeah.
they're your brothers.
Okay.
The rehab center is very important here at Lakeland Regional. As I said before, nobody plans on having a spinal cord injury. Nobody plans to get in a car wreck. You might have do all the greatest exercise in the world, eat perfect, but if you look the wrong way and a bus hits you and you're in a rehab center, it's not something you plan. So that's why it's important. Time after time, you run into someone and they, tragedy occurs, and then what? Then what? If you don't have it, then what? And the only way to get these people back into the community is by having that rehab, by being able to get those people back on their feet, back to being able to do what they can do. I've just seen some amazing things from people who have gone through rehab centers. And also sometimes people say, well, what is a rehab center? Why is a rehab center different? Well, it's different because, well, for one, they typically it's 3 hours of therapy. And 3 hours is a lot of therapy. And that's, broken up usually throughout the disciplines. But that's pretty intense stuff that's done with them on a daily basis. And that's in addition to all the extra teaching to the families. They carry over from nursing and aides. I often say too, when I see a patient, I'm here only so many hours a day. If you need to put the light on at 10 o'clock at night, they need to know how to help you as well. So there's a lot of training for the other staff, the other ancillary support staff, to help along with it. So it's a big community effort to get somebody. It takes a village, if you will, in a rehab to get people back up on their own. And if you think it'll never happen to you, I hope it never does. But things do happen. Tragedies do occur. And the best way to get the recovery, especially in a town of this size, with the hospital of this size, with the volume of patients that we have, it's time for a rehab center.
What about recruiting? I mean, it's Lakeland. People are really nationally well-trained, well-educated, high in their skill level. They gotta come to Lakeland?
As recruiting physical therapy, occupational therapy, and speech therapy can be challenging. It's actually one of the hardest professions to actually recruit nationwide in a hospital. There's some statistics out there showing that. But people ask, well, why Lakeland? Why come to Lakeland? Well, I ask myself that question. Why did I come to Lakeland? I came here 18 years ago. I'd never been to Lakeland before I took a job here. But I love Lakeland. I love the community here. It's just the right size for me as far as a town. It's in between both Orlando and Tampa, so for people thinking that whole I-4 corridor, it's right smack dab in the middle there. For people like traveling, they can either travel from either airport. People like the Disney, you got Orlando, you got Busch Gardens, Tampa, you've got the beach is not very far away. There's a lot of advantages, and the cost of living is cheaper in Lakeland than if you lived in a little larger city. I think that's a big plus, having that and where it's juxtaposition between the two cities. But Lakeland itself, I think, has really revitalized itself. In just in the 18 years I've been here, I've noticed the growth in the downtown, everything from just new restaurants to new businesses to, civic and community clubs, all these different things that exist in Lakeland. So I do think it's a big plus for someone who is interested in coming to a rehab center to work.
What about the hospital? Is the hospital worthy to come to?
Yes, it is very worthy to come to. It's you're talking about a hospital. It's a very large hospital. It's Joint Commission certified, stroke floor. It has a certified. It's a level 2 trauma center. I know of myself from interviewing applicants that come in that work on the acute care side. We get people that come in, and now I'm referring to the people that are working in acute care. We have a very low turnover, and I believe part of that low turnover is an enjoyment of where they work, the types of patients they work with, the community feel, and also the way the employees within Lakeland Regional treat one another. I think there's a lot of sense of community and well-being amongst the employees. So I think from that standpoint, I think it's a very good hospital to work for. An excellent place to work.
Nice.
Okay.
Okay.
Excellent.
Need anything else?
No, I think you did
Yeah,
well.
you got, boy.
Good job.
excellent.
Okay.
Good cut.
Okay.
Okay, looking here.
We'll see if
Sure.
it's filmed.
Okay, camera's rolling.
Sound rolling?
As a physical therapist that is a clinical instructor for physical therapy students, what benefit would the students get from coming to a rehab center if that were built here?
Oh, that would be a tremendous benefit from an academic standpoint, having...
Make sure you include,
Yeah.
oh, okay.
if we would combine.
Okay.
Yeah, let us know
Okay,
where you're headed.
repeat the question again so I can.
Given the fact that you're a clinical instructor
Okay.
with physical therapy students, if Lakeland were to build a rehab center, what benefit would that be to physical therapy students?
Okay. If Lakeland were to build a rehab center, I think it would be a big benefit for students. I'm a APTA certified clinical instructor, so I've taken students in both physical therapy assistant programs. I think one of the things people really look for as a student is what kind of environment am I really going to learn an awful lot? Where is there variety? Where am I going to see some challenges? I tell people all this all the time. You know, when you get out of school, take a job in a hospital. You'll learn an awful lot. Take a job in a rehab hospital. You'll learn an awful lot too. Both areas, there's tremendous learning experience for them coming out of school. So I think having the advantage of having the rehab center here, and as well as the main structure of a acute care hospital, I think it's a big benefit for students.
Good.
Okay.
Great, thank
Yeah.
you.
Be here forever and just keep sitting here and you feel bad because we don't have a rehab center, and your acute care therapist, you know, they're seeing acute patients. They can't always spend as much time on a patient that requires 3 hours of therapy, so that becomes a source of frustration. Sometimes I'm part of the patient as well as I'm part of the therapist, because they want to do more, but because of funding or because of just there's no facility, they don't, there's not much they can do. So.
Okay, we were
Yeah.
rolling
Did
again.
you
Oh, were you?
Yeah.
Oh, okay. Okay. I didn't know we were rolling, but.